With the steep rise in infertility cases across the world, the fertility business is growing at an exponential rate, and so is investor interest. Last year alone, investors poured in a whopping $624 million into the sector, up from less than $200 million invested some 6 years earlier. According to a recent report by Market Research Future, the global fertility service market is expected to reach $36 billion by year 2023, with a CAGR of 8.5%. This opens up a massive opportunity for startups to innovate their ways to success in the fertility space. On today's episode, our crew tracked down a fertility treatment expert to explore numerous issues around infertility, as well as the commercial opportunities in the fertility treatment space. Welcome, Dr. Bukumi Kolade, Chief Medical Director, Vine Branch Fertility Center. Now, this issue of infertility has become widespread in recent times. How widespread is it?
Well, that's really widespread because, for instance, we know that in sub-Saharan Africa, we have a belt called the infertility belt.
Really?
Yes, in which we have infertility rates at times as high as 1 in 3, 30%. But in our part of the world, in Nigeria, is put crudely at about 1 in 5. That's about 20% infertility rates. It's a massive problem.
Even 20% is huge.
It is a massive problem, yes.
Now, before we go into causes, remedy, and what have you, what even is infertility?
Okay, for us to say a couple is infertile, they must have had regular, unprotected intercourse for at least 12 months.
12 months?
Yes. So after 12 months with no conception, we can say, oh, maybe there's an issue here, and they should start considering seeing a healthcare worker with regards to that.
Okay, so infertility is based strictly and solely around conception?
Yes, conception. Conception and also keeping a pregnancy, because you see, if there's conception and there's a miscarriage, that person doesn't still have what he desires.
Okay, so it's of two types: conception and ability to carry a baby to term.
Fantastic, that's right.
Thank you. We'll come to the breakdowns in a short while. But when we talk of infertility, is it restricted to the female gender alone?
It could be the man that's an issue, it could be the woman. You really cannot tell until they have basic fertility evaluation, and then the picture can be clear, and then they can have proper advice on what the issue is. Let me also say that at times nothing is wrong.
At times, medically
nothing is wrong, but then there's still an issue with infertility.
So if there's nothing biologically wrong, as it were, in the strict sense of the word, what could be wrong?
Well, so let me give the statistics.
Please.
30% if you have 100 infertile couples, 30 of them would be because there's a challenge with a man. Another 30 because there's a challenge with a woman. Another 30 because there's a challenge with both. So we have a 10% that have what we call unexplained infertility.
Unexplained?
Yes. In which case, in most centers, you may not be able to put a finger on it. But if you go to advanced fertility practices, they'll be able to dig deeper and say, these are actually the issues. So I put it this way: something is not obviously wrong, even though something is wrong.
Even though something is wrong?
Yes.
Biologically?
Biologically, yes.
What could cause infertility besides biological defects?
If you look at it on the level of male infertility, the commonest thing that causes infertility is abnormalities with the sperms. So when we say sperms, the average man thinks as long as I can ejaculate and have intercourse, then I should be fertile. But that is not necessarily so, because you see, they ejaculate, it should be examined under a microscope, and the sperm cells should be identified, because someone could ejaculate and not have sperm cells. So
there's a difference between the semen
and the sperm cells. Exactly.
So the fluid is not the sperm cells.
It's not the sperm cells. So what we do is we try to say, okay, this guy has semen, let us examine it for sperm cells. So when we examine for the sperm cells, we want to check the count of the sperms. We want to check how well the sperms are swimming. We want to check how normal they appear. At times we go as far as checking their what we call genetic makeup. to help us tell, is there a problem? Because you see, at times, everything is fine, but the genetic makeup is bad.
How do you mean, sir?
Okay, so it's like this. I can look at a car and the car looks completely fine.
Yeah.
But then if I kick it, the engine is not working.
Okay.
In the same way, I could have sperm, the count is normal. It is swimming well. The appearance is fine. But the genetic makeup of the sperm is abnormal. So that kind of man, even though everything looks normal on the outside, we still have challenges impregnating someone.
No matter how healthy the ovary is.
Exactly. Exactly.
Now, when you talk about the genetic composition of a sperm cell, how do you mean? And how does that affect fertility?
Okay, so every cell in the body has something called a nucleus. And inside the nucleus, there's genetic material.
Okay.
Yes. So the sperm cell, being a cell, has a nucleus. And so because the nucleus we describe as the powerhouse of the cell. Okay, so the genetic material, if it's dysfunctional, then that sperm cannot work well.
True.
It could mix with an egg. It doesn't just fertilize it. Or it could fertilize with the egg and then it doesn't develop further. Okay. Or it may develop further and eventually leads to a miscarriage. So whole set of things. Eventually the conception process is not brought to finalization. Okay. Because we can't talk about the delivery of a healthy baby. Yeah, so in that sense, damaged genetic material in the sperms is an issue for fertility. Yes.
Okay, so what are the things that could lead to, you've mentioned one, you've touched on one, the genetic composition of the sperm cell.
Right.
But what are the other things that could be responsible for male infertility?
Infertility. Well, basically, things like the sperm count. If the count is not optimal, there'll be an issue. Then how well the sperms can swim. Because you see, the sperms are released in the vagina and they should swim up to what we call the fallopian tube. And so if they don't swim well, then they can't get to the sites in which they're needed to work. Okay? Then at times, abnormal sperm cells. So at times they appear abnormal. And if they appear abnormal, it will be an issue also for fertilization. You might also like to know that if the sperms are too many, it's an issue for fertility also. So if it's too little, too few, it's a problem. If it's too much, it's also a problem.
Oh, so there's actually
a limit.
A limit.
Exactly.
Max and minimum.
Exactly.
Wow, we didn't know all this. We didn't know all this, but it's a good thing that you are bringing all of these things out to us today. I've also heard, and this is not medical, I've heard, in some private discussions about blood compatibility.
Okay.
Between spouses. We've heard of people who have been together for decades and they couldn't conceive, and there was nothing medically wrong with either of them until maybe they separate or the woman goes somewhere else. And
well, theoretically that's possible.
Okay.
Yeah. So the commonest thing that people propose is what we call rhesus negative blood group. Okay. But that's not responsible for infertility. So this is a good opportunity for me to re-echo that because we have some guys are rhesus positive, some are rhesus negative. Rhesus negativity or positivity does not account for infertility.
Okay.
However, we call something the immune system.
Immune system.
Right. So the immune system of someone may not be compatible with the immune system of the partner. So I'll give you a good example.
Please.
So a lady has intercourse with her husband and then she comes out with a rash. And she develops an abnormal discharge. Yeah. We call it sperm allergy. Meanwhile, that may not happen if she was married to someone else.
Someone else.
Yes. So something as subtle as that. So the immune system at times can overreact to substances from my partner.
Some foreign body.
Exactly. And then that would lead to some form of infertility. But it's not such a common thing.
It's not common.
Theoretically, it's possible.
But we believe that tests will reveal this kind of thing.
Exactly.
Exactly. Now, what are the predispositions that could lead, or the causes of male infertility? Is it about lifestyle?
Okay,
is it age? Is it...
So some of these things are genetic. That's how the guy is born. Okay, some of them are genetic. Some of them were things that happened when the guy was young. I'll give you a good example. Yeah, so you can imagine that when the baby is inside, the testes are not in the scrotum, they're in the abdomen.
Okay.
So if the baby is born prematurely, the testes are really not in the scrotum. Okay, so as the baby develops, the testis descends. Unfortunately, at times you have a boy that is born and his testes are still in the abdomen. And if this is not detected before the age of 4, that child can be sterilized. Okay, so I encourage people.
Because the temperature will be different.
Exactly, will affect it. So that can happen. So I'm young and then I'm playing hockey, ball hits me in the groin, I have testicular pain, I self-medicate, I feel better, that's okay. 10 years down the line, 20 years down the line, I begin to have sperm issues. Because the testes may have been damaged? Exactly. So those things could have happened. The commonest thing that we know is sexually transmitted infections. Okay, so gonococcal infection, chlamydia infection, herpes infections. These things, when they happen, usually, more often than not, people just take treatment that is not sufficient. More often than not, in our part of the world, they self-medicate. In other parts of the world, a diagnosis is made, and they identify the partner and treat the partner, and they treat other people. Okay, but if I don't get an optimal treatment, that infection is there, and it causes scarring in my reproductive tract. Whoa. Such that 10 years down the line, 15 years down the line, I can have an issue, a sperm issue on my hands.
Oh dear.
Yes.
Coming up.
Truth of the matter, a lot of things our young ladies call toilet disease, not toilet disease.
Oh really?
Yeah, they are actually sexually transmitted infections.
What are the other things? I've heard things about food, drinks.
Yeah, so other things that we know, lifestyle changes.
Lifestyle.
Yes.
Okay.
Right now, we know that there was a recent paper I read in Europe. It says 1 in 4 men, in that paper, was a Danish paper, 1 in 4 men have abnormal sperm parameters. 1 in 4. Okay.
25%.
Yes, 25%.
That's huge.
Yes. A friend of mine did a similar study in Nigeria, and he worked in the fertility practice. That practice started in 2003. So he compared 1,000 sperm samples in 2003 with 1,000 sperm samples 10 years later, 2013, and found out that 10 years later, all the parameters were less. The counts were less, the motilities were less, the morphologies were less, the percentage of damaged genetic materials were higher. Okay, and so we're saying what I'm saying is that what we're having in Africa correlates to what's happening in other parts of the world. Yeah. So we're saying that radiations
can also destroy the sperm count.
Yes, so radiations, we carry phones around, we have radioactive materials all over the place. All this can contribute.
Refrigerator, microwave oven.
Exactly.
Even in our cars these days.
Yes, laptops on my laps, all of those things are frying the testes. So we also know, so those are issues. Then generally we think that their weights are increasing because our lifestyles are more sedentary. And when our lifestyles are more sedentary, we tend to gain more weight.
True.
And when weight comes in, some hormones in the body are metabolized in the abnormal way, and they affect sperms.
Oh dear.
So good lifestyle habits. So we're talking about eating healthy.
So obesity could also...
Oh yes, definitely.
Oof.
Definitely. So obesity will affect erection. Erectile dysfunction will be an issue. Medical problems, diabetes, hypertension will be an issue. It can also affect fertility also.
The quality, quantity, and performance of the sperm.
Exactly.
Oh dear.
Exactly.
I've heard things about alcohol.
Yes. Okay, fine. So still talk about lifestyle issues. So we have alcohol, we talk about cigarette smoking, we talk about hard drugs. Okay? We talk about heroin, cocaine, we talk about sushi. I've heard of sushi. Okay? I've heard of squishy. Okay, so all of those things, some of those things we don't even know what is in there.
We don't know the components.
Exactly.
But we just put them in our system.
We don't know what's the component. But you see, that's even far. Let's look at things that we do every day. Rice. This rice that I just cooked this afternoon, maybe it was harvested in Thailand 7 years ago.
True. I've read about that.
And the cost was down then. Now they kept it for 7 years. Now the cost is up, they're now pushing it out.
Because it's nearing its expiry date.
Pushing it out. So they've preserved the chemical for 7 years.
With chemicals.
And that's what I'm taking into my system. So we think all of these things are contributing to the increasing infertility rates, which is why we're talking about organic lifestyle.
That people should go more with organic food.
Exactly. So more natural. So we should go natural.
So these preservatives, canned foods.
On the long run, it's not in our best interest. On the long run, it's not.
So these are some of the factors. I've also heard things about the kind of pants you wear and the undies as a man.
Yes. Yeah. So
how true is this?
To a large extent, that's true. Then, because the testis is outside the body for a reason, because the temperature should be cooler. All other organs in the male body is inside. The testis is outside for a reason, because it stays better. It does its work better when it's cooler. So when I wear nylon underwear, the aeration is poor. I'm more likely to sweat down there, and then temperature is likely to go up.
True.
So these have been shown.
Or tight underpants.
Yes, tight underpants. Yes.
What about cycling?
Prolonged cycling. If it's more than 2 hours, yes.
Prolonged cycling.
Because under there, I get heated up. And then that can predispose to sperm issues.
Wow.
Yes. Then we talked about sauna baths. So I stay in a bath for 1 hour, for 2 hours in the hot water. So of course, all of that time, my testis is also in that hot water.
Yeah, it's boiling.
Yes, so it's also not advisable. So these are subtle things that on the long run will affect our fertility.
Wow, I've been itching to ask. These problems weren't there back in the day.
Okay.
What was the lifestyle like for our phobias that's absent? I mean, I know we're more sedentary now, physical activity is less now. But even in those days, there are people who didn't have that much of physical activities, yet they were very fertile.
Well, that's true. Sedentary lifestyle, as you said, is part of the issue that we have. Then our diet is more westernized. So it being more westernized will contribute to the issues that we have.
So it's less organic now.
Yes. Then also is radiations. We didn't have this many phones around. We didn't have this many radiations around. So all of those things have contributed to...
What about stress?
Oh, certainly a factor.
We cannot cover all of the causes for male infertility today, but you've told us enough for this episode. So let's just move on to the other side and look at the female gender.
Right.
What are the causes of infertility in the female gender?
Okay, so...
or probable causes.
Probable causes. Well, so very commonly we have what we call ovulation problems. We call that anovulation. Ideally, a woman should release her eggs regularly. Okay, so if this doesn't happen, this will make it more difficult for her to get pregnant. Now, apart from that, we have fallopian tube problems. Because you see, when the egg is released, it passes through the fallopian tube to go and meet with the sperm. So if for some reason the fallopian tube is blocked, the sperm and the egg are unable to mate, and then there'll be an issue. Okay? Another common thing that may happen will be in the lining of the womb. At times the sperm and egg has been fertilized, but for some reason they can't get a good site to implant in the lining of the womb. So that can be an issue. Then other gynae conditions, so we call something endometriosis. Okay. So endometriosis is a condition in which the lining of the womb is present in other parts of the body. It causes very severe pain. It's a very, very difficult issue to manage. But we know that it causes infertility also.
How?
Well, it causes infertility because, as I said, the lining of the womb is present in other parts of the body. So what tends to happen is that as that woman is, as you see in her period, and the flow is coming out, the other lining is also bleeding. But the bleeding is not coming out, it's accumulating inside. So all of this leads to accumulation of toxic substances, leads to blockage of fallopian tubes. It's a whole lot of unpleasant stuff.
That could fight even
the embryos.
What about things like ovarian cysts?
Okay, what ovarian cysts will cause is abnormalities of ovulation.
Okay.
Yeah, and the good thing is that, you see, a woman has 2 ovaries. So if ovarian cysts affect one ovary, the other ovary is there to function. Yeah, so the fertility will be compromised, not that it will be out entirely.
So it still has like a spare.
Exactly, to fall back on.
So what happens if the spare is also...
Then we'll have a problem. Then we'll have a problem. So abnormalities of ovulation is a major cause of infertility.
Major cause.
Yes, it is.
You talked about the genetics of the sperm cells.
Right.
Do we have a similar thing?
Okay.
On the other side as well?
Incidentally, we do.
Okay.
We do. But what that correlates more with women is age.
Oh.
Yes.
As you advance in age.
Exactly. So the genetic materials, they deteriorate. And that's why we're more likely to have miscarriages after a certain age. We're more likely to have fertility issues after a certain age. And that's why abnormal, handicapped children are more likely to be born after a certain age, because genetic material in the woman's eggs are damaged. And that's why I still think one of the best ways to prevent infertility, one of the best ways within our control, is to get married early or to start raising a family early. That's still one of the things that is within our control, as that may be.
So advancement in age, does it also affect the sperm cells?
It does, but not as bad as women. So for instance, when a girl is born, her eggs are present. So
really?
If that woman is 40 years old, her eggs are 40 years old.
So it's not like puberty and...
Exactly. Meanwhile, for a guy, his sperms are not present till puberty starts.
I see.
So a woman has a fixed number of eggs. Once it's exhausted, the party is over. So if it gets exhausted at 30, that means she reaches menopause at 30. If it gets exhausted at 40, she reaches menopause at 40. If it gets exhausted at 50, she reaches menopause at 50. But for the guys, the sperms are continuously produced from puberty. So if you see a guy that is 40 years old, his sperms are 3 months old because they're continuously being produced. If you say a guy that is 70 years old, his sperms are still 3 months old, which is why age is not such a big issue. Because if the sperm is not used, the dies of another one is produced. Exactly. So it's regenerative. That's the word. So sperms are regenerative, eggs are not. So age is a big issue for fertility, especially in women. It's also for men, but not as much as in women. Yes. We looked at predisposable factors for men, so I think we should also look at it for women. Okay. What are the lifestyle issues that women need to be wary of when considering fertility and infertility issues? Yeah. So as we said for the guys, sedentary lifestyle leads to increased body weight, increased body mass index. All that, because by the time my weight increases over 80, over 90, I'm more likely to have ovulation issues. And with ovulation issues come difficulty in getting pregnant. So that's a strong one. Okay. Now, apart from that, infections. So, truth of the matter, a lot of things our young ladies call toilet disease, not toilet disease. Oh, really? Yeah. They are actually sexually transmitted infections. Really? But to make it sound more civil, we tend to talk about toilet disease. In actual fact, there's something called toilet disease. Oh, really? Yes. It's a slang. It's a, medically, there's nothing called toilet disease. Really? We would think that, the toilet, because the way it is, there will be probably a high risk of infections. Well. And especially because of the way it is constructed, the private part of the woman, that it can be easy for fluids, for airborne, we are laymen anyway. Yes, that's how we think, but that's not necessarily so. So if you're talking along these lines, you might as well go deeper, okay? For instance, we found out that it is best when you want to flush the toilet to cover the lid. Because when it's left open, you have all of that spiraling up, okay? It's so bad that when you culture the wall of the toilet, it has a high load of organisms. I read about that somewhere. Okay, but the good thing about this is that these organisms don't cause infections many times. Okay. Yes, so it's not such an issue. And that's why if you have paper towel in the toilet, those things have a high load of bacteria on them. But we always keep them there. This is shocking. They have a high load of bacteria. So rule of thumb, cover the lid when you need to flush. Whoa. So make a lot of difference. So it's been medically proven that there's nothing like toilet infection. Yes. I'm surprised. Anyway. If you did a Google search and said toilet disease, you don't see anything come out. So they will all be sexually transmitted disease? Yeah, more often than not. At times it's vaginitis. But to make it sound civil, it gets to the toilet disease. But aren't there some things that the body produces, of a woman produces, that are like anti-agents or... Okay, fine. So that's why I talk about vaginitis. Okay. Okay, because the vagina is never dry. It's just like the mouth. It's never dry. So there'll be some secretion. Okay. Yeah. So the nature of the secretion will now determine: is there an infection? Is there not an infection? Okay. All of that. So it doesn't necessarily have to be STD. Exactly. Okay. So we call that vaginitis. Because we've read about things that have to flush the vaginal wall. Exactly. We heard about even some bacteria that are normally in there. Beneficial. Exactly. To fight other foreign agents that may be
destructive.
Exactly. Yes.
Okay.
Yes. So
this is a major cause of infertility.
Yes, because the infection, if it goes in, it can block the fallopian tubes. That's the commonest cause of blockage of fallopian tubes.
Okay.
Pelvic infections.
Pelvic infections.
Yes, and at times for some people, they just had a baby, and for some reason they got infected. Okay, some other person just had a pregnancy termination and for some reason got infected. And that's why some people can say, oh, I had 2 babies effortlessly, and then I'm staying for 9 years, I'm staying for 10 years, nothing is happening. Very likely at the last delivery, something happened.
So it's not all infections that you actually feel pain or discomfort.
Exactly.
Some may just be living in there.
Exactly.
And destroying things. Yes. But not causing you any discomfort.
Yes, that's true.
So regular frequent tests is also
will help.
Will help.
That's right.
All right. What about other things that have to do with food and drinks, as you've explained about the man?
Okay. So
are there certain kinds of food that makes one predisposed towards infertility as a woman?
Well, anything, as I said for the guys also, we should as natural as possible. Because natural food have what we call antioxidants.
Yeah.
And antioxidants are always beneficial for fertility. Natural food, natural diet, exercise, keep my body weight down. Okay? If I have keep to a partner, avoid unprotected sex. Those are things that we can do to avoid unwanted pregnancies. Those are things we can do to
minimize risk exposure.
Exactly.
To this factors.
Yes.
What about things like you've talked about
radiation? Okay. So radiation also, as it is for men, it is for women. So keeping laptops on my lap, radiation from phones, from telcos, from microwaves, all of those things have been shown to be damaging to rapidly dividing cells.
Yeah, because I once consulted, for a media organization that helped them to set up a television station.
Right.
And then I went to the radio arm to see what was going on. I saw that where this transmitter was kept was just the next room to the editing suite. I had to remove a lady from that editing suite. Because I'd read somewhere about radiation and infertility and all of those things. A young lady, but I just wasn't comfortable keeping her in that editing suite.
And so close to that source.
So close to the radio transmitter.
Yes.
She didn't know why, because I didn't want to be laughed at. Because I wasn't sure of my facts. I didn't want to be laughed at. So I didn't tell her why I took her from editing and I put her in MCR. Go to the master control room and be working there. Perhaps till today she may not understand. She may just feel, this man, he didn't want me to be an editor. But I just wasn't comfortable.
Yes, it may just be staying so close to that source for so long.
Because the radio transmitter emits so much radiation. But let's not digress.
Right.
Now we've looked at all of these causative factors. What are the things one can do to mitigate?
Coming up.
Would it be in order for one to advocate that medical trained practitioners should have a way of integrating their
should have an exposure
or even interfacing with those who are trained in the natural remedy area so that they can work together?
Yes, so as I mentioned briefly earlier, starting a family early, it's a good way to avoid infertility.
Okay.
Avoiding pelvic infections, both for the males and the females, is a good way to avoid infertility. Having a low, keeping my weight appropriate. We call something body mass index. Yes, keeping my weight in suitable body mass index for my height is appropriate. So we're talking about exercising, we're talking about avoiding excessive weight, we're talking about avoiding alcohol, avoiding smoking, avoiding hard drugs, even small, seemingly simple things like non-prescription drugs. Yes, we should avoid it because, for instance, things like blood pressure medications can actually affect fertility.
Oh, really?
Things like there's some pelvic, so there's some medications that are prescribed that can affect fertility. And so if my doctor knows that I'm having a challenge along those lines, all he has to do is give me another option that is safe for me.
And some stimulants too.
Yes, that's right.
Well, there's also this constant friction between natural remedy and medical remedy. Some have said that because of the greed of some medical practitioners, they will not toe the line of natural remedies like certain food substances, certain nuts, organic food that could even correct, infertility.
Well, I put that this way. A rule of thumb we have in medical practice is first, do no harm.
Do no harm.
Yeah, so my priority or the priority of any healthcare worker is first not to do harm. The challenge we have more often than not is that, you see, our training is along the lines of orthodox medicine.
Okay.
So if a client comes to me and says, oh, doctor, this fruit improves my sperm count, does it really? There's no way for me to know, because I'm not trained along those lines. In other parts of the world, they call what we call Ayurvedic medicine, in which people, Ayurvedic medicine, in which people actually go to school for 4 to 6 years to go and study about natural remedies. And they actually come out and are called doctors. And they're better able to counsel and say, oh, this drug is safe, this food is safe, this fruit is not safe. You understand that? So
there's this kind of thing.
Exactly. So many times it's because the doctor does not know. So he can't give an opinion.
Yeah.
Okay? But in a more global context, some of those things are useful. Yeah, some of those things are useful.
So would it be in order for one to advocate that medical trained practitioners should have a way of integrating their
should have an exposure
or even interfacing with those who are trained in the natural remedy area so that they can work together?
That would be
in integrative alliance.
That would be a good thing to consider. So I'll tell you, for instance, that in what we call natural remedy, an aspect of medicine that has come in very useful is in psychiatry. Okay. I know psychiatry, I know also in dentistry. Some aspects of medicine, natural remedies have come in very useful. And that interface has happened. It is not formalized, but I know on particular fronts it has happened. And
it's working well.
And it's working well. So at the end of the day, it is what will make my patient get better. If it is water, if it is taking an almond fruit, if it takes paracetamol, my fundamental interest should be what will make this person better and get back to life faster.
The end result.
Exactly.
So is there a sense in which one could advocate on a platform like this that Western medicine practitioners in the infertility sector or every other sector should intentionally, deliberately, consciously seek out those who have training and expertise in natural remedies and work synergistically with them?
That would be a fantastic idea. That would be a fantastic idea. Part of the reluctance we may have as orthodox medicine practitioner is what we call evidence. Because something evidence-based medicine, meaning that I've exposed 100 people to this. I've not exposed 100 people to it. What is the evidence that this thing actually works? Okay, so usually for the average doctor, if there's evidence to support it, I'll give you a good example. So at times somebody comes in and has a cough, and then in recent times the pediatricians say, oh, take honey and lemon. I'd be wondering, I'm going to a pediatrician, he recommended honey and lemon, which doesn't sound medical in that sense. But evidence overall has shown us that honey and lemon will help cough.
I can testify.
Oh, beautiful. So if there's evidence for it, the average doctor will recommend it. The average doctor should recommend it.
Because it's about solving problems.
Exactly. Yeah, exactly. Yes. So that's why I said in some aspects of dentistry, some aspects of psychiatry, natural remedies have come in handy, and I know doctors that are working with our other colleagues on the other side and things.
Thank you. Related to that is this opinion expressed in some quarters that charlatans are beginning to find their way into this practice. How can a potential patient recognize a charlatan? For example, if you're dealing with people in some other professions, you only need to interface with them for a few minutes to be able to weigh their level of commitment or even expertise. What are the signs that a patient should look out for before he commits to a treatment?
Beautiful question, beautiful question. First is that the patient has responsibility to have information before coming to a practitioner. Okay. So I should have information and talk with the practitioner. If I'm not sure, I should seek for a second opinion. That's important. Number one. Number two also is that if I come to a practice and it's a fertility practice or any practice at all, they should have documentation. I'll give you a good example. So somebody comes in and says, oh, to register in this place, this is the fee. It should be a statutory fee. Because at times somebody comes in and for this person, because you're well dressed, we'll give you a bill of 5,000. For one else, we'll give you a bill of 1,000.
So it's by arbitrary.
Arbitrary. Okay, because those are signals that these guys don't have standards in place, and any center that doesn't have standards cannot have quality for any length of time. That's the truth. And so we have small things like that. Of course, you want to be sure that they have qualified people working there. So many times it's not just about the structure. It's not all about the online presence. It's about when I get there, I should get there. What do I meet on ground?
Have a feel.
Exactly.
The
person I've engaged, the questions I've asked. That I've asked this person this question, I've asked another person, is there consistency in what they're telling me? This person says my fee is this, in the same center, the same thing, a different fee. That's not consistent. So those are small telltale signs. That could be a warning something is not right. But as I always love to say, if you're not sure, get a second opinion.
Get a second opinion.
Get a second
it always pays to even get a second opinion. Even when you're sure, still get a second opinion because it's all about your body.
Exactly.
That we're talking about here.
Exactly.
Well, it's a good thing that you clarified that for us. For some ailments like cancer and so on, they tend to tell you these are early detection signs. What are the early detection signs for infertility?
Okay, for infertility, what we should look out for. So a woman that has irregular periods, that's early detection. Because what that suggests is that her ovulation is not regular.
Yeah.
Okay? So that's important. A woman that has extremely painful periods.
Painful periods.
Yeah, she should watch out for that. For the guy, it may be difficult to say, but you see, if one testis is bigger than the other, that's an early sign. Or if the testes are absent.
Absent.
Yes.
Completely absent.
Yeah, so those are early signs we can look at.
What about pain during sex?
Okay, we can look at that also, especially for the woman. We can look at that as a possible factor. Okay. Yes.
Well, we've been talking all about the medical aspects, but this program is stricto sensu about business. So we would not be complete if we don't delve into the world of business. Is a hospital a business? Let's begin from there.
Well, a hospital is a business.
Okay.
Because a hospital, or let me put it this way, most hospitals are run for profit. The profit may be
our climes
in our clime.
In other climes?
Well, in most places, that's why I say most hospitals.
Around the world?
Around the world, are run for profit.
Okay.
Yeah, so by the time we say it's a hospital, more often than not, that's what it is. By the time we say it's an NGO, a non-governmental organization, more often than not, it's a non-for-profit organization.
Okay, what about a hospital that's not an NGO, but is required to be a social service center?
Okay, fine. So that's different.
Okay.
So that's a hospital. That's why I said most hospitals are.
Like so, many of our primary health
centers. Yes. Like many of our primary health centers. Truth of the matter is that to give out good health services, funding is required.
Yeah. So
it may be free to the person accessing it, but providing it is not free. Many times that provision is the problem. Because I've set up a primary health center, but it's not properly funded.
Yeah.
So it cannot work as best. It cannot deliver the service as well as it should.
True.
Yes, so that's an issue.
Even if it starts delivering on a qualitative basis, it may not be able to sustain it.
Sustenance will be an issue, that's right. That's right.
So it will pay our society to begin to look at hospitals as a business. Is that what you're saying?
Exactly, I think so. That's true.
Okay, so if a hospital, because the reason why I asked that question is some believe that the Hippocratic Oath requires doctors to just give cares, and treat people, and you shouldn't worry about tomorrow. Tomorrow will take care of itself for you.
Well, in a sense, yes. But you see, what we also know as doctors is that the Hippocratic Oath puts a demand on me not to ask a patient for money. But that does not mean my accountant cannot ask that patient for money. Okay? Because the issue that will happen is that...
So who takes the money?
You understand what I'm saying?
Collects the money.
You understand?
The CMDA has to decide.
So it's unethical in that sense to discuss financial issues with a patient.
Okay.
But I should have someone that is qualified, that is trained, that can do that for me.
Okay.
Because I need the money for the system to run.
To run, yes.
And if I'm giving good quality services, as we said, I need good money to sustain that service.
Now, having taken that out of the way, the healthcare industry is growing exponentially globally. In fact, I read a report in Forbes sometimes last year that says that it's projected that the fertility industry will grow to $36 billion by year 2023. So what that tells me is it's a huge area.
I agree.
Ditto for many other areas, you know. So, but I'm concerned because despite the increasing opportunities in that sector, in the healthcare sector, which in the United States, for instance, healthcare is a synonym for business, you know. How come in our climb on the African continent, we don't have many investors putting their money in the healthcare sector?
Many reasons. Many reasons. Peculiar to our climb is, you agree with me that our environment is not particularly business friendly.
Yeah, but then despite that, people still go into farming, people still go into manufacturing, people still go even into education sector. You have a lot of people who have loose idle funds, and rather than keep them in the bank, they channel into the education sector.
That's one part of it. It's not exactly business friendly. Also is that people are really not seeing that opportunity in it.
They're not seeing it.
Yes. So I'll give you a good example. So I have a hospital. Because I have a hospital, I want to encourage my son to become a doctor so that I can inherit it. That's not enough. Because what will happen is that that boy doesn't want to study medicine. Maybe he wants to become an actress or an actor, okay? Or maybe he wants to become a musician.
Yeah.
And now I'm twisting him to study medicine. Then after he finishes, he now comes to Daddy, I want to go to America. What happens to the practice?
His heart is not there.
You understand that?
Yeah.
So many times because of this, these businesses are not
Or
sustainable.
could it also be because the medical school, I haven't been there, but from the way I peep in from afar, it doesn't seem as if there's emphasis in the curriculum on finance, business, investment, and what have you.
That's a big part of it. That's a big part of it. Because the fact I'm a doctor doesn't necessarily mean I can run a hospital business.
Yes.
Coming up.
So if I'm an investor, I have to partner with someone who has certification.
Well, that would be the best thing.
What kind of certification are we talking about here?
Okay, so what I tell my people that want to do this, it'd be nice for you to have a mentor. You may want to work in a center. I mean, if I want to look private sector, I may want to work in a center that is a properly run standard hospital. You may want to spend 4 years, it's like apprenticeship. This is different from medical school. This is on ground. The rubber is hitting the road.
Yeah.
What do I have to learn? For 3 years, for 5 years. So when I come and establish my practice, I hit the ground running.
True.
Yeah. So there's that part of that. And I may have to go as far as getting formal education, like an MBA or a degree in entrepreneurship. Yes. So that, but medical business with our population over 190 million. It's a gold mine.
And the way we live, actually.
Yes, it's a gold mine.
Our population is one thing. Our lifestyle tends to predispose us to
so many things.
So many ailments. And as a matter of fact, even the fact that our stress level is so high. So the opportunity is huge. Yes. And that's why I'm wondering why investors, why those who have the capital refuse to keep them. They rather keep them in the food chain, among other things.
So they're not seeing the opportunities. That's one part. The other part is that healthcare business, it may take some time for it to pick up. You need to build a reputation.
You need to build.
Yes. For instance, I work in a hospital. It's been existent for 20 something years. It was in the last 6 years that it picked up.
So most people don't have the patience. Most investors don't have that kind of patience.
Exactly.
How about going for franchise with organizations that already have the reputation?
Fantastic idea.
We've seen that happen in the UAE.
Fantastic idea.
We've seen that happen in India to great effect.
Fantastic. Even in Nigeria, we have that happening now.
Oh, really?
Yes, we have. One or two hospitals I know in Abuja has an Indian franchise, Another one has a German franchise.
Okay.
Yes. So we see that.
So that would be an avenue to explore.
Beautiful.
But perhaps it's because the knowledge is not there.
Yes.
Well, and that's why we're having a program like this, to open people's minds, to make them to be aware of the commercial opportunities around them and how they can appropriate those opportunities. Yeah. Well, we talked about investment in the healthcare sector. Let's narrow things down a bit to the fertility sector. What's the entry point if I want to go into it and play as an investor cum practitioner?
Yes. Well, the entry point for me is to have someone who is qualified and is certified to set up that.
All right.
So in our part of the world, we have an association for fertility and reproductive health. Okay. So the person has to be certified with that. Then with the government, we also have some certification that has to happen. Okay, so more often than not, I'll have to go in partnership with someone that has those certifications.
So if I'm an investor, I have to partner with someone who has certification.
Well, that would be the best thing to do.
What kind of certification are we talking about here?
Okay, fine. So we're saying that to start a fertility practice, the person at least should be a gynecologist, apart from having fertility training. Okay, then if it's not a gynecologist,
foundational grounding.
Exactly. Gynecologist
and gynecology.
Exactly.
Right.
Apart from fertility training.
Yeah.
Another thing we could do, it could have a PhD in the reproductive endocrinology. Okay. He will also be in a position to start a fertility practice.
Even if you didn't have your foundation in
obstetrics and gynecology.
Okay.
Exactly. Because the reproductive endocrinologist understands the reproductive process.
Okay.
Yes. And so that's a good launching pad for him to take up the work.
Okay.
Yes.
Now, if I want to be an accountant and open an auditing firm, I know that I have to get certification with ICANN.
Right.
Among others. Are there bodies that are specifically focused on certifying people, or are there boards around the world?
Fine. So in our part of the world, what obtains is that, as I said, there's an association of fertility and reproductive health.
Yeah.
So that association, when it only established, they'll give you the guidelines. Before you kick off, they come to examine the place to be sure that things are properly in place.
Okay.
And then they do a yearly certification to be sure that you are abiding with the standards.
Oh, so there's a checklist.
Oh yes, definitely there's a checklist to be sure that things are properly done.
Okay.
Yes.
Now, regulatory issues, what will I be looking at?
Okay, regulatory issues, well, this same body is trying to put some regulation together because for some reason, in the Nigerian law, the regulations are not clearly spelled out. And so this body is trying to come together and these are specific things. In fact, before this body came on, practitioners just practiced the regulations where they trained. So if you trained in the UK, you just practice UK regulations. If you trained in the UAE, you just practice your regulations. Okay, but fortunately this body is up. And
so in Nigeria as we speak,
yes,
we don't have a structured regulatory framework.
By law, no, but the association has regulations that binds the practitioners.
Okay.
Yes, and so as long as you're a member of that association, you are bound by those regulations.
Oh, now that's clear.
So you tell me, what if I'm not a member of that association? Then I'm not bound, and really I should not practice.
So if I'm not a member,
yes,
and I decide to set up my fertility clinic or center,
yes,
what happens?
So before I am giving,
and I refuse to join your association.
I'm giving permission to start that practice, the government licenses with that association. So it's a check and balance kind of thing.
So who gives permission? Ministry of Health?
Yes, yes, for the states really.
Okay.
State Ministry of Health.
So
yes.
They will liaise. At any rate, the people in the ministry will be members of the association.
Exactly.
So it's still head or tail. You still come back to the association.
Yes, please.
What about legal framework? That's presently absent.
Well, most of what we provide is within the context of a regular hospital. However, when it comes to things like sperm donation, you now have legal implications coming in. Egg donation, surrogacy. Okay, so we have that aspect. So we have consent forms, we have legal agreements that are abided by as recommended by the association.
Okay, so is it enforceable in a court of law?
Oh, yes, it's a contract. Yes, it's enforceable in that sense.
Despite that our constitutional laws do not have
something clearly spelled out. Exactly.
It's still enforceable.
Yes, it is.
I haven't taken that out of the way. What's next as an investor?
what's next as an investor? I still think that there's so many areas for us to look at in our clients. For instance, we're beginning to scratch the surface of the fertility world, providing fertility care. And when you have 190 million people, and we said infertility is about 20%. Okay?
And still growing.
And still growing. And then when you look at that, in our part of the world, the biggest fertility centers are doing biggest fertility center maybe doing 600 cases per year. 600 cases per year. We're not even going to begin scratching the surface. In India, we have places where they do 200 cases in 1 month.
In Ukraine, I heard of a place in Ukraine where they do they do thousands.
Do you understand that?
Because people go from the US.
So even the fertility world, we're beginning to scratch the surface.
Okay.
Yeah, but then there are other opportunities. I mean, every day people leave this country to go for kidney transplant.
Yeah.
Transplantation.
Yeah.
It's an aspect of healthcare that needs investment into. Critical care, intensive care units. In the whole of Southwest Nigeria, apart from the teaching hospitals,
yeah,
you really don't have private intensive care centers. Do you understand?
Well, don't break our heart on this show.
So there are areas
with the statistics.
There are areas to do stuff.
Yeah, but let's dovetail and narrow things down. Let's narrow things down to fertility center.
Okay.
We'll have opportunities some other day to look at the broader issues in the healthcare sector. I've done my due diligence with the association. I've been cleared.
Right.
I've gotten my certification. I've been cleared. How much does it cost to set up a basic fertility center?
Practice.
How much are we looking at?
You're using the right words. Basic fertility center.
Basic.
A basic fertility center.
To take off and safely take off.
Basic fertility center, about $100,000.
Okay.
Yes.
Whatever you want to quantify that
About
in your local currency.
Okay, fine. So we have what we call an advanced fertility center.
Okay.
Which will be about $30,000 more than that. So about $130,000
for advanced facility. But a very standard elite facility center.
That'll be $130, $30,000.
$30,000.
Yes.
That will be enough for you to take off.
Oh yes.
Bearing recurrent expenditures.
Yes.
Okay. Now, what's the organogram of a typical fertility center like?
Practice. Okay. So we have different units.
Okay.
So you have what we call the clinical unit.
All right.
So in the clinical unit, yes, in the clinical unit you have the doctors and the nurses, and you have the sonographers.
Okay.
Okay. Apart from that, you also have an administrative unit.
Administrative.
Yes. So in the administrative unit, you want to have the personnel management, you want to have the accountant, want to have the people that maintain the service.
Okay.
Okay. Now you have a unit that combines this, the clinic manager.
Clinic manager.
He does a bit of administration and a bit of clinical work. In a sense, it's the face of the center. Yes, so that's what it is that, and then from that level, they begin to break down into other strata.
Other strata.
Yes.
And I want to assume you will have like a board of trustees or board of directors.
Oh, yeah.
At the apex.
So I have to repeat myself. Ideally, you should have an ethical committee.
Ethical committee.
Because there's so many ethical issues that are there.